Hi everybody and welcome to my channel with BB. This video of mine is about human papillomavirus, that is also known as HPV in short form. This is an infection that commonly causes skin or mucous membrane growth, which are known as warts. There are more than 100 varieties of human papillomavirus. Some types of HPV infection cause warts and some can cause different types of cancer. Most HPV infections do not lead to cancer, but some types of genital HPV can cause cancer of the lower part of the uterus that connects to the vagina, which is known as cervix. Other types of cancer, including cancer of the anus, penis, vagina, vulva, and back of the throat, that is oropharyngeal cancer. This oropharyngeal cancer has been linked to HPV infection. These infections are often transmitted sexually or through other skin-to-skin contact. Vaccines can help protect against the strains of HPV most likely to cause genital warts or cervical cancer. Now let me tell you the symptoms. In most cases, your body's immune system defeats an HPV infection before it creates warts. When warts do appear, they vary in appearance depending on which kind of HPV is involved. There are 4 types of warts which I'm going to tell you now. The first type is genital warts. These appear as flat lesions, small cauliflower-like bumps, or tiny stem-like protrusions. In women, genital warts appear mostly on the vulva, but can also occur near the anus, on the cervix, or in the vagina. In men, genital warts appear on the penis and scrotum or around the anus. Genital warts rarely cause discomfort or pain, though they may itch or feel tender. The second type is common warts. Common warts appear as rough, raised bumps and usually occur on the hands and fingers. In most cases, common warts are simply unsightly, but they can also be painful or susceptible to injury or bleeding. The third type is plantar warts. Plantar warts are hard, grainy growths that usually appear on the heels or balls of your feet. These warts might cause discomfort. And the fourth type is flat warts. Flat warts are flat-topped, slightly raised lesions. They can appear anywhere, but children usually get them on the face and men tend to get them in the beard area. Women tend to get them on the legs. Now I should tell you something about cervical cancer. Nearly all cervical cancers are caused by HPV infection, but cervical cancers may take 20 years or longer to develop after an HPV infection. The HPV infection and early cervical cancer typically do not cause noticeable symptoms. Getting vaccinated against HPV infection is your best protection from cervical cancer. Because early cervical cancer does not cause symptoms, it is vital that women have regular screening tests to detect any precancerous changes in the cervix that might lead to cancer. Current guidelines recommend that women aged 21 to 29 have a Pap test every 3 years. Women aged 30 to 65 are advised to continue having a Pap test every 3 years or every 5 years if they also get the HPV DNA test at the same time. Women over 65 can stop testing if they have had 3 normal Pap tests in a row or 2 HPV DNA and Pap tests with no abnormal results. If you or your child has warts of any kind that cause embarrassment, discomfort or pain, you should seek advice from your doctor. Now let me tell you the causes. HPV infection occurs when the virus enters your body, usually through a cut, abrasion, or small tear in your skin. The virus is transferred primarily by skin-to-skin contact. Genital HPV infections are contracted through sexual intercourse, anal sex, and other skin-to-skin contact in the genital region. Some HPV infections that result in oral or upper respiratory lesions are contracted through oral sex. If you are pregnant and have an HPV infection with genital warts, it is possible your baby may get the infection. Rarely, the infection may cause a non-cancerous growth in the baby's voice box, and that is larynx. Warts are contagious. They can spread through direct contact with a wart. Warts can also spread when someone touches something that already touched a wart. Now let me tell you the risk factors. HPV infections are common. Risk factors for HPV infection include number of sexual partners. The more sexual partners you have, the more likely you are to contract a genital HPV infection. Having sex with a partner who has had multiple sex partners also increases your risk. Age. Common warts occur mostly in children. Genital warts occur most often in adolescents and young adults. Weakened immune system. People who have weakened immune system are at great risk of HPV infections. Immune system can be weakened by HIV/AIDS or by immune system suppressing drugs used after organ transplants. Damaged skin. Areas of skin that have been punctured or opened are more prone to develop common warts. Personal contact. Touching someone's warts or not wearing protection before contracting surfaces that have been exposed to HPV, such as public showers or swimming pools, might increase your risk of HPV infection. Now let me tell you the complications. Oral and upper respiratory lesions. Some HPV infections cause lesions on your tongue, tonsils, soft palate, or within your larynx and nose. Cancer. Certain types of HPV can cause cervical cancer. These strains might also contribute to cancer of the genital, anus, mouth, and upper respiratory tract. Now let me tell you about prevention. First, let me tell you about prevention of common warts. It is difficult to prevent HPV infection that cause common warts. If you have a common wart, you can prevent the spread of the infection and formation of new warts by not picking at a wart and not biting your nails. Plantar warts. To reduce the risk of contracting HPV infection that cause plantar warts, wear shoes or sandals in public pools and locker rooms. Genital warts. You can reduce your risk of developing genital warts and other HPV-related genital lesions by being in a mutually monogamous sexual relationship, reducing your number of sex partners, using a latex condom, which can reduce your risk of HPV transmission. Now I should tell you about HPV vaccine. This is very important to listen. 3 HPV vaccines have been approved by Food and Drug Administration. The most recent was Gardasil 9, which is approved for use in males and females ages 9 to 45 to protect against cervical cancer and genital warts. The Centers for Disease Control and Prevention (CDC) recommends a routine HPV vaccination for girls and boys ages 11 and 12, although it can be given as early as age 9. It is ideal for girls and boys to receive the vaccine before they have sexual contact and are exposed to HPV. Research has shown that receiving the vaccine at a young age is not linked to an earlier start of sexual activity. Once someone is infected with HPV, the vaccine might not be as effective or might not work at all. Also, a response to the vaccine is better at younger age than older one. But if given before someone is infected, the vaccine can prevent most cases of cervical cancer. The CDC now recommends that all 11 and 12-year-olds receive 2 doses of HPV vaccine at least 6 months apart instead of the previously recommended 3 doses schedule. Younger adolescents ages 9 and 10 and teens ages 13 and 14 also are able to receive vaccination on the updated 2-dose schedule. Research has shown that the 2-dose schedule is effective for children under 15. Teens and young adults who begin the vaccine series later at ages 15 through 26 should continue to receive 3 doses of the vaccine. The CDC now recommends catch-up HPV vaccination for all people through age 26 who are not adequately vaccinated. Now let me tell you about the diagnosis. When patients come to us, we might be able to diagnose HPV infection by looking at your warts. If genital warts are not visible, you will need one or more of the following tests. The first test is vinegar, that is acetic acid solution test. A vinegar solution applied to HPV infected genital areas turns them white. This may help in identifying difficult to see flat lesions. Pap test. Your doctor collects a sample of cells from your cervix or vagina to send for laboratory analysis. Pap test can reveal abnormalities that can lead to cancer. The third test is DNA test. This test, conducted on cells from your cervix, can recognize the DNA of the high-risk varieties of HPV that have been linked to genital cancer. It is recommended for women 30 and older in addition to the Pap test. Now let me tell you the treatment. Warts often go away without treatment, particularly in children. However, there is no cure for the virus, so they can reappear in the same place or other places. Medications. Medication to eliminate warts are typically applied directly to the lesion and usually take many applications before they are successful. Examples of the medication include salicylic acid. These over-the-counter treatments that contain salicylic acid work by removing layers of a wart a little at a time. For use on common warts, salicylic acid can cause skin irritation and is not recommended to be used on your face. The second medication is imiquimod. This prescription cream might enhance your immune system ability to fight HPV. Common side effects include redness and swelling at the application site. The third medicine is Papillomavirus, and this is another topical prescription. Papillomavirus works by destroying genital wart tissue. Papillomavirus may cause burning and itching where it is applied. The fourth medicine is trichloroacetic acid. This chemical treatment burns off warts on the palms, soles, and genitals. It might cause local irritation. There are some simple surgical and other procedures which I should tell you. If medication do not work, your doctor might suggest removing warts by these methods which I am going to tell you. The first is freezing with liquid nitrogen, that is known as cryotherapy. The second one is burning with an electrical current, that is electrocautery, and they can also be removed surgically, or there is an option of laser surgery as well. Now I should tell you treatment for HPV in the cervix. If you have an abnormal HPV or Pap test, your gynecologist will perform a procedure called a colposcopy using an instrument that provides a magnified view of the cervix, which is known as colposcope. Your doctor will look closely at the cervix and take samples, that is biopsy, of any areas that look abnormal. Any precancerous lesion need to be removed. Options include freezing, that is cryosurgery, laser surgical removal, loop electrosurgical excision procedure, that is known as LEEP in short form, and cold knife conization. LEEP uses a thin loop wire charged with an electrical current to remove the thin layer of a section of the cervix, and cold knife conization is a surgical procedure that removes a cone-shaped piece of the cervix. Well, this was my video about HPV infection. I hope you will like this video because this is a very informative video and this is a common illness. If you are suffering from warts or any other illness, please post your comment and I'll try to make a video about your illness, and if I do not find a time, I'll try to reply to your comment as soon as possible because I reply to almost every comment on my channel. Okay, since this channel is dedicated to help humanity across the world, so please do not forget to share my videos to help others. Thank you so much for watching this video. See you in next video. Bye for now.